The amount of genitals and bugs. Story time. A 30-something-year-old male comes in complaining of groin pain. He felt movement in his scrotum that wasn't the usual ball sack movement. He said he'd been hurting for a little while. What's a little while? Like 3 weeks. 3 weeks of groin pain is not normal. Any other complaints? He said no, just this. Proceeds to fling open his gown and his sheets and show me the largest scrotum I have ever seen. There were also things moving next to it. This is a much more recent story than the one that went viral. So you can imagine then start thinking terrible, terrible things. I asked him how the pain started, what the symptoms were, if there was anything that precipitated this particular instance. He said what every single scrotal abscess person says to me when I ask that question. Every single, how often does this happen? A lot. This happens a lot. Leave your genitals alone, please. So I asked him what happened. He was just shaving like he normally does. Just shaving his ball sack. He was in the shower, everything was clean. When I got a report on this gentleman, I only heard scrotal edema. I was in a considerable amount of pain, so I assessed everything that I could normally, and then I went for the scrotum. As I gingerly picked up his scrotum, I realized this is about the size of a basketball. A small basketball, but a basketball nonetheless. And this man was not much taller than me, maybe 5'8", 5'9". There was a visible opening that he said was related to where he had shaved. So he shaved his scrotum. He said, I might have nicked myself. This happens to lots of people, folks. Please stop touching your genitals. As I'm assessing, I'm noticing yellow, red, green drainage coming from the opening in his scrotum and little tiny wiggly things. It is kind of a wriggling motion that's normally in the scrotum, so I had to double take at first to see what exactly I was seeing and feeling, because it felt like individual little pieces were wriggling, not like the whole. When I look down, I don't need to squint to see that there are also little trails on his chuck pad. I don't know where the trails go except for off the bed. And then I realized I looked down onto the floor and there are maggots on the floor. There are maggots in the bed. There are maggots crawling up his thigh. There are maggots crawling almost to his head. This is the worst Dr. Seuss book that ever existed. Literally almost dropped his scrotum and felt like the worst nurse ever, but I maintained my composure and I gently set it down on the pillowcase support that we had provided for him, and I said, I need to go get some supplies so I can clean this and make this way more comfortable for you. Would you like some pain meds? This looks incredibly painful. As I put the scrotum down on the pillow support, it gushed serosanguinous, very purulent, smelly, cheesy, yellow, awful. Grab some pain meds and some cleaning supplies as per our wound care orders, and a large bottle of packing for this particular wound, which had already had an IND. Gentleman was the nicest gentleman I've ever met, by the way. And as I was packing his wounds, he did very well in tolerating the procedure. And volumes, huge volumes of pus coming out of his scrotal sac with a variety of other things. Once he was all cleaned up, he was very grateful. I said, dude, you know what? I feel so bad for you. I'm so sorry this happened. This is not a big deal at all. But please, please stop shaving your balls. Nurses, friends, family, whomever you are, please leave your genitals alone. This is the 100th case, I feel like, I've had of some sort of insect in a genital opening because someone has harmed themselves inadvertently by manscaping. It's not worth it. Just wax. I don't know. Just stop shaving. Stop shaving your genitals.